you have almost about 60 or some 60 plus PowerPoints in gram positive. These represent 2 lectures, not only one. And maximum you talk about 30 PowerPoints for the slides. Now you are in charge or responsible for what is in the PowerPoint. Okay, what I'm giving to you here just is the main points I like you to remember or to memorize. I see it is very important to know such information I'm giving to you. Otherwise, in the lectures, it looks like easy because you will see in most of the PowerPoints, you will see different virulence factors, different diseases, some mechanism of action of the toxin, heat labile, heat stable toxin, and so on. So this is important information to study. I don't have enough time to address everything. So that's why I'm giving you the basic things. This is one thing. If you have any concern, any questions, let me know. Midterm exam, inshallah, in 2 weeks' time. Just to remember. What else? Yeah. Tomorrow in the practical, you will see more or less what I address for gram positive. So you will see how staph looks like. You're going to do catalase, mannitol salt, coagulase, DNase, and then you look to alpha beta hemolysis. You will see Passitress index, and you see optician. You see everything. So there is no difference between what you will take in the lab and what is in the lectures. Okay? Because the exam will include both, whether MCQs, whether OSPI, whether whatever, SAQs and so on. Now, to go back to, did you look to the PowerPoints for gram positive? Huh? If you have any concern, I don't mind to repeat whatever you would like me to repeat. The message is to ensure that you understand what I'm talking about, rather than the amount I'm giving to you. It doesn't matter the amount. I don't bother about the content or the amount of the information. I am concerned about knowing the right information for the microorganism and for the disease. Now, back again to gram-negative bacteria. For gram-negative bacteria, one of the important points I like you to address it again briefly before I go into the others. The structures of gram-negative bacteria, regardless positive or negative, in relation to endotoxin, lipopolysaccharides. Lipopolysaccharides or endotoxin have a core and then group specific, O antigen, H antigen, K antigen, and you should know this by now. And then the lipid A. Lipid A responsible for both fever, pyrogenic effect, and remember when I say pyrogenic, different than pyogenic. When you talk about staph, strep, mainly you're talking about pyogenic. Pyogenic means the formation of pus. So pus is an exudate, is the production of whatever dead cells, dead bacteria, dead tissues, and so on. This is a pus. So pus can tell you from the clinical point of view what it can tell you. Pus, what can tell you from the clinical point of view? What pus can tell you? That your defense mechanism working, right? It tries to defend the disease itself. So pus is a good indication that your host or your defense mechanism is good in this case. Now, the other issue related to lipid A, the issue related to septic shock. That's why when you treat gram-negative bacteria, you don't lyse the bacteria rapidly, because if you lyse the bacteria rapidly, there would be a huge amount of endotoxin released, and it may cause septic shock. And you will study septic shock later on, unless you study it by now, but you will hear it later on. Now, we divide gram-negative bacteria into two big groups. One group is called Enterobacteriaceae or enteric bacteria. And based on the growth on McConkey agar, you will see it in the lab next week, not this week, that we divide it into lactose ferment and non-lactose ferment, right? Lactose ferment, from the clinical point of view, we consider it normal flora, non-pathogen. Putting in mind that non-pathogenic bacteria in its place does not cause disease, but it move other place, it will cause an infection. So it becomes pathogenic, right? So E. coli, part of the normal flora, but mainly it causes urinary tract infection. So almost 85–90% of community UTI infection, endogenous source of infection from yourself, whether female or male, because this is part of the normal flora. So this is a message I would like you to understand. Now, other infection related to E. coli include different types like enteropathogen. You see it in the PowerPoint, enteropathogen, enterohemorrhage, enteroinvasive, and so on. Enteropathogen E. coli contain K antigen, one of the virulence factors, and mainly it causes traveler diarrhea or infantile diarrhea. This is the main points I like you to know about. When we come to, again, Salmonella typhi, paratyphi, Salmonella typhimurium, this typhimurium causes food poisoning. And as I mentioned, food poisoning, either due to growth of bacteria or production of toxins. So if it's due to production of toxins, the symptoms appear early, within few hours. If the infection due to growth of bacteria like Salmonella, it takes about a day or 2 days for the symptoms to appear. Common symptoms, abdominal pain, diarrhea, vomiting, fever, and so on. I mean, nothing in particular for the food poisoning. Now, what I like you to know, in case of Salmonella typhi, the carriers, some of the population, when infected with Salmonella typhi, the cured, symptoms disappear. However, it become carriers. These are important for anyone handling food. That's why we always test food handlers in presence of carrier of Salmonella typhi. And when we test that, we look for what we call VI antigen. So anyone work in the food sector, we screen him. We take urine, stool, blood, and so on, take everything. And then we test for what diseases he can. One of the important diseases is the typhoid. That's why you will see typhoid usually occur in developing countries, in poor countries, where they handle the food without knowing who is infected or who carry the organism itself, right? Now, Shigella dysentery, Shigella sony, you will see it in the PowerPoint. It produces toxins, one heat labile and heat stable, and it causes dysentery. The key here is that when you diagnose dysentery, you should differentiate between bacterial dysentery and parasitic dysentery. So this, because management is different. Both cause acute colitis associated with blood. You will know more details in clinical later on. But there are several species of Shigella. You will see it in the PowerPoints. I already put the PowerPoints in. And then I will talk about Proteus. You will see it in the lab, where it has mainly caused infection in hospital, particularly UTI and others. Produce urease. These urease break down urea and makes the urine alkaline. It leads to precipitation of oxalates. That's why when we see oxalates in urine by microscope, you can tell this organism may be Proteus. There is no 100%. We only what we call best guessing. So if I tell you Proteus cause mainly E. mainly urinary tract infection does not mean it does not cause other infection. It causes other infection. It's mainly with UTI infection, but it can cause meningitis, anything. It can, we've seen Proteus causing otitis media, to my surprise, but we see it anyway. But the percentage or not very high as we compare it with UTI infection. And I think finally, I was talking about Pseudomonas. Pseudomonas, it causes a lot of infection. I cannot assign one infection for Pseudomonas aeruginosa. This is one of the, what you call it, opportunistic infection. You see it always in immunocompromised, ventilators, burn unit, where there is something wrong with the patient itself. So if a patient comes to me with whatever symptoms, I'm not going to look for a Pseudomonas in community. I will look for others. But in hospitals, Pseudomonas is an important pathogen because opportunistic. You cannot get rid of certain microorganisms in hospital. I will talk later on infection control practice in hospital. So there are organisms in hospitals, you will never get rid of it. It's always there all the time, like Pseudomonas aeruginosa, Acinetobacter pneumoniae, Staphylococcus aureus. It's there. So the best way to prevent the spread of these microorganisms is to practice a good infection control. This is the message. So what is the problem with Pseudomonas aeruginosa? Is issue related to multi-drug resistance. I know long time ago, we used to treat Pseudomonas with a combination of drugs. Now it's very hard to treat Pseudomonas aeruginosa infection. Is always multi-drug resistant along with Acinetobacter pneumoniae. I will discuss it later on. Now, because it caused a lot of outbreaks in hospital, like Staphylococci, like Pseudomonas aeruginosa, like the other, we do what I call it typing, because you will look for outbreak in hospitals. If you work in a hospital, you will see a lot of problems in certain units, a lot of death, a lot of mortality due to circulation of certain microorganisms. The Pseudomonas, one of these organisms that cause fatal infections, usually cause endocarditis, meningitis, everything, you name it, endophthalmitis, everything. So what we usually do to trace the outbreak, because if there is an outbreak, you have to trace where and how the organism started or the infection started. So you do what we call it typing. So different typing with different microorganisms carried out to detect the outbreaks. Have nothing to do with diagnosis. I'm talking about outbreaks now. For the Pseudomonas aeruginosa, we do what we call Piocene typing. This is important to remember, Piocene typing. It depends on the production of pigments called piocyanine. So the same applies for Staphylococcus aureus, and you have to remember that we do what we call phage typing. For gram-negative bacteria, what is phage? What is phage? And I have this question in the exam. If you answer it, I will remove the questions. What is phage? Phage is a virus grow on bacteria. Like, and then you do typing for gram-negative bacteria by what? Serological typing based on O and H antigen. That's why in Salmonella typhi, we do serology typing. The reason we do serology with typhoid, why? Because in the early stage of the disease, we take the sample from blood. After a week or 10 days, we take a sample from urine and stool, because the organism is cleared from the blood later on, after 10 days. So when we diagnose typhoid, we have to take blood, urine, and stool. And usually we do serology. And I remember I said the serology test is a Vidal test. You remember? Vidal test, one of the tests used for typhoid. So we determine O and H antigen in the case of typhoid. Now, leave Pseudomonas, and then I'm supposed to talk about now new gram-negative bacteria, not new, but I mean others, gram-negative bacteria. One of the important is cholera, Vibrio cholera. You know cholera? This is what we call it, Vibrio cholera. There are several species of Vibrio cholera, right? Um, there is a classical one, and there is another species. You will see it in the PowerPoint. What I would like you to know about cholera, this is one of the organisms usually associated with contaminated food and water. That's why we see a lot of this infection in poor countries, low resources countries. That's why in textbook, they classify it as Asiatic cholera because it's very common in Asia, right? So usually associated with what you call a contaminated food and water. And this is what will be your best guessing later on. If you ask your patient where you come from, what type of living you live in, and so on, you can tell. If someone have a good hygiene, reasonable food and water, no contamination, you will never expect cholera. So you need to see the history of the patient before you decide what type of organism associated with. One of the characteristics of cholera is actually it grows in alkaline media. So it needs to grow in alkaline peptone water. And there is a special media, you will see it in the PowerPoint, we call it TCBS, thiosulfate citrate bile salt sucrose. Is it in the PowerPoint? So again, when I diagnose cholera, I take stool specimens, I grow it in general media, like McConkey, and at the same time, if the clinician suspects cholera, I grow it in a specific media. If it grows in TCBS, that means it's a cholera. If it does not, I have to look to the general media, what organism grow on McConkey agar. Now, the problem with cholera, with the classical cholera, that it produces very potent toxin, chloragen, from the same name, from the cholera itself. It causes hypovolemic shock. It causes really severe diarrhea. This diarrhea is very characteristic from the clinical point of view. It looks like ricey water. You know, when you cook rice, you see the water in the top, this is like ricey water. So you can tell from the diagnostic point of view. Why it's fatal? Because hypovolemic shock, hypokalemia, and so on. Because this toxin act on adenyl cyclase. You know adenyl cyclase enzyme? You know adenyl cyclase? Convert what? ATP to cyclic ATP. Bravo. So this is the way. So it causes imbalance in electrolytes and cause severe diarrhea. You will see it in the PowerPoint. So that's why we always advise anyone eating vegetable outside, particularly if he's not washing this food or this vegetables, we usually say you should add lemon with it. So because it does not grow in acidic condition. People who take H2 antagonistic, for example, when you block the HCl, usually they may be more susceptible to cholera than others because cholera susceptible in acidic condition. That's why if you're going to eat any vegetables outside, you should really use lemon, at least to reduce the number of cholera. Right? So I will, enough for cholera, and you will see it in the PowerPoint later on what other information in relation to cholera. Now, the third of the other organism, Campylobacter jejuni. I'm not going to say much about it. There's only one slide there because you're going to study it later in the block. But one of the important characteristics of Campylobacter jejuni, it grows in high temperatures. The optimum temperature is about 42 degrees centigrade. It grows in higher temperature. Now, the other organism, again in the PowerPoint, Helicobacter pylori. I don't know if you heard about it or not. This is the one of organisms that cause what? Duodenal ulcers. So this is now one of the organisms being discovered to be associated with ulcers. And I'm sure that by time, we will know that most of the diseases we hear about it, they're usually a causative agent behind it. It takes time to detect that. To detect, I remember 20 years ago, we used to treat ulcers different, but now we treat duodenal ulcer or gastric ulcers with antibiotics, with triple antibiotic therapy. You will take it later on in the pharmacology. So now we know Helicobacter pylori, that organism cause ulcers. And you will hear later on with different diseases. One of the diseases discovered a few years ago, cervical cancer or cervical cancer, is due to, you remember, due to what? Human papilloma viruses. So this is a discovery. So I'm sure there is a lot of organisms associated with infection. I'm sure by time you will know, we will know what is the causative agents, and the management will be different. Now there is a lot of work in different countries, particularly in Japan, where they associate asclerosis with microorganisms. So in future, we may treat asclerosis, تصلب الشرايين, later on with an antibiotics to treat such bacteria. Breast cancer, they are looking for certain viruses that can cause breast cancer. So by time, if we discover that, they may produce a vaccine and they will prevent the disease, like we do with HPV, human papilloma virus. Now we have vaccine. When I talk about vaccine later on with human papilloma viruses. So most of the infection we'll hear about it, actually there is a causative agents, but it takes time. So to discover Helicobacter pylori and related to ulcer, it takes a long time to discover that. But at least they found that ulcer or duodenal ulcer now can be treated with a triple therapy of antibiotics. I'm not interested what type of therapy, you will know that later on, but the concept, that's what I like to hear, to know something about. Now, let me move to other gram, this is a gram negative bacilli, especially enteric bacteria in the intestine. There are other gram-negative bacteria. We call it gram-negative cocci because these are gram-negative bacilli. The gram-negative cocci, it has few organisms. I will concentrate on one or two in POD, and then you will study the rest later on when we come to teach you in the blocks later on. So we will talk about Neisseria. Neisseria is one of the organisms associated with different infection, and we see it frequently everywhere. These are gram-negative cocci, or diplococci. So now you have gram-negative diplococci and the gram-positive diplococci. Gram-positive diplococci is what? Streptococcus pneumonia. Gram-negative diplococci is a group of Neisseria. Same principles for other microorganisms. You will have in the PowerPoint what type of species, most important characteristics related with Neisseria, what is the virulence factors, either due to adherence or toxin production. This is now, you will see it from the slide. But at least you know the concept of how bacteria cause disease. Because these organisms are gram-negative, you expect that it will have endotoxins, a gram-negative diplococci. Now, these gram-negative diplococci, there is two species, important species, Neisseria gonorrhea and Neisseria meningitidis. Meningitis is a disease. Bacteria is meningitidis, D-I-S at the end. This is the name of the organisms. We call it Neisseria. You have it in the PowerPoint. Two important points to know about Neisseria gonorrhea. It has a specific media called thion maltin media. You will see it in the PowerPoint. The same concept. If we isolate a causative agent, we grow it in a general media, and if the clinician suspect gonorrhea, we grow it in a specific media, thion maltin media. If it grows in thion maltin, fine, خلاص, this is Neisseria. If it's not, we look to the general. This is the concept. So you need to, unfortunately, you need to memorize some of these specific media because sometimes it comes in the OSPI and in the MCQs as well. But you have to remember it at least. I know you are a clinician in the future. You may not need to remember these media, but you have to at the moment, you know, right? Because some students come and ask me why you have to know gram-positive cocci, gram-negative whatever, thion maltin, and so on. But you have to. I mean, this is a course where you have to remember these media or these microorganisms. Now, with grow in thion maltin. Now, gonorrhea is one of the sexually transmitted disease. You will take it in the block later on in more details. But what is the key with gonorrhea? That the specimen used to diagnose gonorrhea, particularly in female. In female, gonorrhea is asymptomatic. So you may carry gonorrhea with no symptoms. This is very critical now, because during the delivery, if the child gets with the exudate or secretion during the delivery, it may cause what we call ophthalmia neonatorium, and it cause blindness. So usually we have to screen one of the disease, one of the organisms we screen for female in case of gonorrhea, if she carry gonorrhea, because asymptomatic, different than the men. So this is the key now. We have to screen for before delivery for the carrying the organism itself. Now, when the diagnosis is critical, because we see a lot of problems in diagnosis. In diagnosis, you have to take cervical swab or cervical swab. You don't have, if you take vaginal swab, it will be negative. So you have to have what we call it cervical swab to diagnose Neisseria gonorrhea. Now you will have most of the information in the PowerPoint in the Neisseria gonorrhea. But these are the main points I'm telling you about it. When we receive the complaints from outside in MOH that some labs, they have negative result. Some other labs, they may have positive result with gonorrhea because it is asymptomatic. Now, the other Neisseria, Neisseria meningitidis. Neisseria meningitidis, one of the organisms I usually concentrate on because this one related to what you call it mass gathering, particularly during Hajj. Because there are certain type of people who carry Neisseria meningitidis as part of the normal flora in nasopharyngeal swab. So these are an important organisms associated with mass gathering, particularly in Hajj. These organisms are capsulated, and there are several types of Neisseria meningitidis. Type A, B, C, Y, W135, and recently X. Unfortunately, you have to remember that because these are important when we talk about vaccines later on. So there are 5 types, serotypes of Neisseria meningitidis. And I'm sure you know that anyone coming to Hajj, he must submit a certificate that he vaccinated against meningococci. Right? So mainly Neisseria meningitidis, when it goes to the blood, it causes meningococcemia, and it can cross the blood-brain barrier, cause meningitis. So this is one of the severe complications of Neisseria meningitis. So we need to prevent people who go into Hajj by giving the vaccine. So that there are 5 types of the vaccine itself. A, B, C, W135Y, and recently there is type X. I'm not going to go into details because you will study that in the neuro block. I will give it to you in details, but it's important to know that what is important about Neisseria meningitis, there are some regions that they carry Neisseria meningitis as part of the normal flora. These are a source of infection as a carrier. So they don't actually have symptoms, but they carry the organisms. Few years ago, we used to give everyone coming to Hajj what you call it a prophylactic antibiotic. So this prophylactic antibiotic is the function or the role of prophylactic is to reduce or to minimize the number of microorganisms in the flora. So instead to spell, say, thousands or millions of microorganisms, you spell a little of these microorganisms. So we give them prophylaxis. So that was, say, 30, 40 years ago. Nowadays, because there's a lot of people coming to Hajj, we only specify certain regions that they are carry Neisseria meningitis as part of the normal flora. We call this population African belt. African belt, or الحزام الأفريقي, where they are carriers. So anyone coming from African belt region, we usually, before enter to go to Hajj, we usually give them what we call it prophylactic antibiotic. Now you should know what is prophylactic antibiotic by now. Prophylactic, you are not treating, you are not doing anything except you minimize or you reduce the number of whatever carrier, number of the organism as a carrier. So you don't really treat. You remember, we talk about prophylactic, you remember? When we talk about Streptococcus agalactia, we do give a prophylactic. So in Hajj, people coming from African pelt, we give them what we call it prophylactic. And at the same time, we should vaccinate everyone against vaccine. Now, as far as I remember, I was talking about in Streptococcus pneumonia, 2 types of vaccine, polysaccharide and conjugate. مش كده ولا لا؟ You have to ask, I'll interrupt so I can have rest while I'm talking. So what is the difference between polysaccharides and conjugate? I was going to give it in the exam, but and I don't mind to tell you what is in the exam. It doesn't matter. But I need you to understand. Right? So the main difference between polysaccharides and the conjugate, regardless what is the organism, what ساكت. still كتير. طيب, what is the difference between polysaccharide and conjugate? لا أنا I cannot hear you. أنا خلاص I'm getting old. You have to say loud. What? Say it again. What is no? Polysaccharide capsulated conjugate because it is from the capsule. No. Polysaccharides, you cannot give it in children under what? 2 years of age. Polysaccharides, you cannot. Conjugate, you give it for less than 2 years of age. There are many differences, but this is the main difference here. Now, there is a vaccine, we call it the quadruple vaccine. It contains serotypes A, C, W, 135, and Y. So there is 4 types of serotypes is in the vaccine, is in Saudi Arabia. And the only country we have the vaccine as a routine, as a child routine vaccination is meningococcal vaccine. So we vaccinated at age 9 and 12 months. So any child at 9 months, he will take a dose of quadruple vaccine, and at 12 months, another dose of a quadruple vaccine. for meningococcal vaccine. You need to remember that, at least as a clinician later on, you should know what type of vaccine we give it to the child in Saudi Arabia. And I will tell you that later on, because there is a lot of changes in relation to routine vaccination in Saudi Arabia. But this is the vaccine we use so far for Neisseria meningitis. Now, let me leave Neisseria for the sake of the time. You will see most of the information in the PowerPoints. Now, I think we have 3 other organisms important to address here in briefly, and you will address it in details later on. We call it coccobacilli, gram-negative coccobacilli. Coccobacilli, it means that in fresh culture, it looks like cocci. When the culture becomes old, it looks like bacilli. So we call it coccobacilli. There are 3 important organisms. When I say important pathogen, does not mean the others are not important, but at least for sake of the course, I concentrate only on 3. Don't look to the watch. When I go, I will let you know. One of the organisms important to know, Haemophilus influenza. Haemophilus influenza has nothing to do with influenza. Influenza is due to virus, right? Now there is a vaccine for influenza, for viral influenza. Do you know that or not? Do you know that? There is a vaccine and you should be vaccinated. You should take the vaccine. Now we used to have a trivalent vaccine of influenza, viral influenza, has 2A and 1B type, 2 type A and 1 type B. We moved this year to quadruple vaccine. So we have now a quadruple influenza vaccine. This information is important to know as a future clinician later on. So the new quadruple vaccine, it has 2 type A and 2 type B. I'm not going into details into that. But now we moved from trivalent to quadrivalent, from 3 ل 4 vaccine. Now, if you look to the pamphlet of the influenza vaccine, you will see it varies from 1 year to another. It depends on the most predominant influenza virus circulating in different parts of the world. Saudi part of the world that it collects all influenza during viral influenza during winter, and they send it outside and they look to what type of the viruses associated with severe influenza. And these types, they added to the vaccine. So every year you will see different serotypes or types of the influenza vaccine. And I'm sure you know that we have so many types of influenza. So even if you take the vaccine, you will get influenza, viral influenza later on, right? So, but I'm advising you to take the quadruple influenza vaccine. And this is by law. Anyone work in hospitals, by law. Now, a year ago, I am in the committee with MOH. By law, every healthcare workers must be vaccinated against viral influenza. Okay. Back again, and I'm giving you information about influenza. Now, back again to Haemophilus influenza. Haemophilus influenza has nothing to do with influenza. One who discovered Haemophilus influenza a long time ago, it is one of the lower respiratory tract infection. The one who discovered it, the symptoms was related to influenza. So he called it Haemophilus influenza. But we still have the same name until now. Haemophilus influenza they have several serotypes. Again, the same thing. And one of the capsulated organisms. So since it is a capsulated, they usually associated with what? With invasive disease. So encapsulated bacteria usually associated with invasive disease, like meningitis, for example. That's why, because the importance of meningitis, we usually have what we call it a vaccine. So we now have a vaccine against the Haemophilus influenza. We call it Hep B, type B influenza, because there are several types. One of the important types of the Haemophilus influenza, type B. This organism must grow in presence of what you call it two factors, X factor and N factor. You will have it in the PowerPoint. So when we grow with the X factor and N factor, you will grow Haemophilus influenza. In absence of X and N factors, Haemophilus influenza will never grow. So you will see it in the lab, how it grow in presence of one of X factor and N factor. N factor is a nicotine dinucleotide, and X factor is a hemoglobin. You will have it in the slide later on. This organism associated with respiratory tract infection, commonly with pneumonia, as well as otitis media. So usually if someone suffers from otitis media, what it comes to my mind as an organism, usually Haemophilus influenza. Not 100%. It could be anything else. Could be pneumonia, strep pneumonia, could be anything. But one of the organisms comes to you, and this is what I usually call it best guessing. This is how can you differentiate between good practitioners and normal practitioners? The best guessing of what is the organism, right? So Haemophilus influenza, one of the organisms associated with pneumonia, associated with otitis media. The other disease associated with Haemophilus influenza, epiglottitis. Epiglottitis اللي هو بالعربي لسان المزمار. لو انتوا يعني you will know it later on. Epiglottitis. From the clinical point of view, you will know it later on. But you need to remember epiglottitis is associated. Usually in a child, it's about 6 to 7 years age. You get what you call it epiglottitis. Now, the other disease associated with Haemophilus influenza, meningitis, of course, and that's why there is a vaccine. We call it Hep vaccine, Haemophilus influenza type B vaccine. Now, the other organism was a coccobacilli is Bordetella pertussis. Bordetella pertussis. You have it in the PowerPoint. One of the organisms causing whooping cough. You know whooping cough؟ اللي هو بالعربي السعال ديك. تلاقي كده you can characteristic for a child usually cause infection in 1-2 years old usually, but now we see it in adolescents, but usually we see it in the younger, and that's why you see it. He's breathing زي الديك كده. That's why we call it whooping cough. Now you will study it in detail later on. It has a special media called the ginger media. You need to remember the media is specific for whooping cough or Bordetella pertussis. There is a vaccine for Bordetella pertussis, so we don't see it much now. The vaccine, you remember the vaccine for Bordetella pertussis? Huh? What is the vaccine for whooping cough? Huh? DTP, the diphtheria, tetanus, and P. P is a pertussis. So now this is اللي بنسميه بالعربي الثلاثي triple vaccine. So how we take triple vaccine? Huh? What is the administrations of the vaccine? Huh? We give it 3 times and booster dose. Booster dose اللي بنسميها المنشطة. So we give it 1, 2, 3 dose, whether which about 2, 4, 6 or 3, 5, whatever. It's 3 dose plus booster dose, DTP. So we don't see much actually of the pertussis, right? Now the last organism, for the sake of the time, that of course you will see more virulence factors like other organisms produced by Bordetella pertussis. The last organisms I usually concentrate on, because it's very common in Saudi Arabia, البروسيلا، البروسيلوسيس اللي بالعربي الحمى الملطية اللي هي andulant fever أو Malta fever. This disease is very common in Saudi Arabia. That's why I concentrate on Neisseria meningitis, because it present in Hajj, one of the concerns of the disease in the kingdom, and the Brucella. And you should know in each country there are certain disease predominant. And this is, you have to know that. So in Saudi Arabia, if someone comes with FUO, you know what is FUO? Huh? What is FUO? FUO. What is FUO? بجد والله you don't know? Huh? I mentioned before, fever of a unknown origin. Or PUO. What is P? Pyrexia of unknown origin. You see, fever of unknown. If someone comes with FUO or PUO, usually we screen for either TB or Brucella, right? This is, you have to know this information. If you work in some places, you have to know what is the main diseases, main diseases associated with SACA. What is the main disease associated? For example, if in Sudan, for example, the main disease we look for what? Huh? Malaria. Why? We're not going to hide anything. This is science. In Egypt, Egyptian, when we look for someone coming with fever, what we look for? Huh? Hepatitis C and chest tube. You have to know this information. So in certain places, there are diseases predominant. In certain places here in the kingdom, there are leprosy, there are chest tube. For example, leishmania. You know leishmania? What is leishmania? You did not start? No, not yet. Type. You will take it later on. Leishmania. So there are diseases associated with certain regions. You have to be familiar with that, right? So Brucella, one of the disease that is a coccobacilli, but usually transmitted by consuming raw milk, is a zoonotic infections. So what is zoonosis? Infection transmitted from animals, right? So what other diseases is a zoonotic infection? Huh? What other diseases I mentioned before? This will come in the exam. Can you provide 2-3 organisms or 2-3 diseases, source of infection, zoonotic infection? 3-4, or one of the short answer questions. 3-4 diseases associated as endogenous source of infection. So you should know this by now. So please, when you study micro, not because I am micro, no, but if you study macro, don't memorize it like other subjects. Don't memorize it, but then turn it to another organism, we turn another organism. No, you have to understand the concept and you have to correlate other organisms with each other. So I will ask you, give me 3 diseases that the vaccine act as toxoid, for example. So you have to know by now what diseases you study related to given toxoid. So when you give a toxoid, this means the disease to you do what? Toxins. So you should know now what disease associated with mainly toxins. Now, Brucella is a host specific in animal. So there are certain type of species. You will see it in the PowerPoint. Brucella militensis. This is the one in kingdom, is usually associated with goats and camels. And there is another Brucella aportus and Brucella suis. What important information to know that some of these Brucella aportus, it causes abortion. But Fortunately, it causes only a portion in animal, not in human. So pregnant women, they never get abortion from brucella because the placenta for the animal contain what you call it erythritol, an amino acid, and placenta called erythritol. This amino acid not present in human. So the organism grow heavily on presence of erythritol. That's why it causes abortion. And there is a vaccine in relation to the animal in case of brucella. If you consume raw milk, you will get brucella. If you don't consume raw milk, you will never get brucella. That's why if you go to the state or you go to Europe, very hard to see a patient with brucella because they never drink raw milk. They have to boil it or whatever they do with it. So this is associated with what you call it environment. So when you drink raw milk for brucella. So one of the diseases commonly coming from animal, particularly consumption of milk or raw materials, even with the meat and other, anything coming from zoonotic infection. So these are the three organisms associated with what we call it Coccobacilli, Haemophilus influenza, Bordetella pertussis, and brucella. And there are several species. You will have it in the PowerPoints that cause brucellosis as well. This is what we call it undulant fever. It has a very characteristic pattern of fever. You remember when I say fever pattern, can tell you what organism may be associated with. Okay? You're going to have I already upload the PowerPoints. So all this information in the PowerPoints. You have any questions? In relation to, what? Tell me what, read, and I don't have glasses.
So someone is saying, did we take toxoid? Was it mentioned in the campus lecture? So
do we take toxoid?
Yeah.
What type of disease would take a vaccine as a toxoid? Tetanus, bravo. And? Diphtheria. Diphtheria. Tetanus with diphtheria. These are the two diseases mainly associated with toxin production.
One student is asking, what are those three zoonotic organisms? And she mentioned H. influenza as an example.
H. influenza is not a zoonotic. No. H. influenza has nothing to do with zoonotic. The only zoonotic, probably I mentioned, I don't know, Bacillus anthracis and brucella so far. And then you have what other disease as a zoonotic? Salmonella, typhi, murium. This is one of the questions. What is the food poisoning due to? Salmonella. What is the species? So Salmonella typhimurium, from actually eating raw eggs or chicken or whatever. This is, we call it a zoonotic infection coming from animal. But not H. influenza. No, H. influenza is not a zoonotic infection. It's a respiratory tract infection, right? Now, some of you ask me about what I studied. What I'm saying is very similar to what you see in the PowerPoint. But you are, and I'm clear now, you are in charge of any informations in the PowerPoint. Okay? Although I put the exam without looking to the PowerPoints, but I will expect that you will read the PowerPoints and you are in charge of whatever information in the PowerPoints. But I like you to concentrate on the principles. For example, brucella, you will read in the PowerPoints, is an intracellular organism. So if it is an intracellular organism, what type of antibiotics we should use to treat? What criteria to treat brucella? I'm not talking about treatment, but I like to know the principle. So if you have an intracellular organism, so you should look for antibiotic that can penetrate. And you already study antibiotics, مش كده؟ ولا لا؟ If you have someone, say, prostatitis, some with Salmonella typhi, these are intracellular organisms. So you should think of a drug that penetrates. One of the problem with Brucella intracellular that we have to use combination of the drugs. Okay. Right. Any questions? Everything is clear? You are in charge of the PowerPoint. I don't want any comments.